Hello and welcome. Today we're diving into the world of ophthalmology to understand a condition called ptosis, often recognized as drooping eyelids. We'll explore what causes it, how it affects vision, and what can be done to address it. Whether you're personally affected, know someone who is, or simply curious, this video will provide a comprehensive overview of ptosis. Let's talk about what causes ptosis. The etiology is quite varied. Ptosis can be congenital, meaning present at birth, often due to a problem with the levator muscle, which is responsible for lifting the eyelid. Acquired ptosis, on the other hand, develops later in life. Common causes of acquired ptosis include age-related weakening of the levator muscle, known as a paneurotic ptosis. Neurological conditions like myasthenia gravis, Horner's syndrome, or even a stroke can also lead to ptosis. Less frequent causes involve local issues like eyelid tumors, trauma, or even prolonged contact lens wear. Identifying the underlying cause is crucial for determining the best course of treatment. Now, let's understand what happens inside the eye and eyelid to cause ptosis. Essentially, ptosis occurs when the muscles responsible for lifting the eyelid aren't functioning properly. In congenital ptosis, the levator palpebrae superioris muscle either doesn't develop correctly or is damaged during development, hindering its ability to lift the eyelid fully. In acquired ptosis, the issue usually lies in the connection between the levator muscle and the eyelid itself, the aponeurosis, stretching or detaching with age. Neurological conditions disrupt the nerve signals controlling the levator muscle. Regardless of the cause, the result is the same: a drooping eyelid that obstructs the upper field of vision. Regarding how common ptosis is, congenital ptosis affects a small percentage of newborns, though precise numbers vary depending on the study and population. Acquired ptosis is more prevalent, particularly among older adults, as age-related weakening of the eyelid muscles is a common occurrence. The epidemiology also varies depending on the specific underlying cause. For example, ptosis caused by neurological conditions will reflect the prevalence of those conditions. Overall, ptosis is a relatively common ophthalmic condition, and it's important to be aware of its various forms and potential implications. The most obvious sign of ptosis is, of course, a drooping eyelid. This can affect one eye's unilateral ptosis, or both eyes of bilateral ptosis. The degree of drooping can vary from mild, where it's barely noticeable, to severe, where the eyelid significantly covers the pupil, obstructing vision. People with ptosis may need to raise their eyebrows or tilt their head back to see properly, leading to forehead wrinkles and neck pain. In children, significant ptosis can interfere with visual development, potentially leading to amblyopia, also known as lazy eye. Other symptoms might include eye fatigue, dry eyes, or excessive tearing. Diagnosing ptosis involves a thorough eye examination by an ophthalmologist or optometrist. The doctor will assess the degree of eyelid droop and measure the margin reflex distance, MNRD, which is the distance between the upper eyelid margin and the corneal light reflex. The levator muscle function will also be evaluated to determine its strength. A complete neurological examination might be necessary to rule out underlying neurological conditions. Imaging studies, such as MRI or CT scans, may be performed in specific cases to further investigate the cause of ptosis, especially when a neurological etiology is suspected. Ptosis can be classified based on its cause and severity. We've already discussed congenital and acquired ptosis. Acquired ptosis can be further categorized into a paneurotic, neurogenic, myogenic, and traumatic ptosis, depending on the specific underlying mechanism. The severity of ptosis is typically described as mild, moderate, or severe, based on the amount of eyelid droop and its impact on vision. Understanding the specific type and severity of ptosis is crucial for guiding treatment decisions. Treatment for ptosis depends on the underlying cause and the severity of the condition. If ptosis is mild and doesn't significantly affect vision, observation may be sufficient. However, if ptosis impairs vision or is cosmetically bothersome, surgical correction is often recommended. The most common surgical procedure involves shortening or tightening the levator muscle to lift the eyelid. Another surgical option involves suspending the eyelid from the forehead muscles. Non-surgical options, such as ptosis crutches that attach to eyeglasses to lift the eyelid, may be considered for patients who are not suitable candidates for surgery. Addressing the underlying cause, such as treating myasthenia gravis, is also an important part of management. Unfortunately, preventing congenital ptosis is not possible. However, for acquired ptosis, minimizing risk factors can be helpful. Maintaining good eye health and seeking prompt medical attention for any neurological symptoms or eyelid injuries are important. Avoiding excessive eye rubbing and being mindful of contact lens wear habits can also potentially reduce the risk of developing certain types of acquired ptosis. The prognosis for ptosis is generally good, especially with appropriate treatment. Surgical correction is often successful in improving eyelid position and restoring vision. However, the outcome can vary depending on the underlying cause and the individual's response to treatment. Ptosis surgery can sometimes result in overcorrection or undercorrection, requiring further adjustments. In terms of recent research, advancements in surgical techniques, such as minimally invasive approaches, are continuously being explored to improve outcomes and reduce complications. Research into the genetic causes of congenital ptosis is also ongoing. Staying informed about these advancements can help patients and clinicians make the most informed decisions about ptosis management.